Have you ever felt a wave of fatigue so heavy you had to sit down and just thought, well, I'm not as young as I used to be? Or maybe an odd discomfort in your jaw that you blamed on sleeping wrong? It's a thought that crosses millions of minds every day. But what if I told you that for nearly half of all seniors, those quiet, dismissible moments aren't just signs of aging? What if they are, in fact, the whispers of a heart attack in progress? A silent one, the most dangerous kind. I'm Dr. Robert Clark. For over 30 years, I've had the privilege of caring for thousands of patients in their golden years. And in that time, I've sat with far too many families in a hospital room, piecing together the subtle clues that were missed in the weeks leading up to a major, life-altering cardiac event. I've seen firsthand how a little-known type of heart attack can slip by completely unnoticed, leaving damage in its wake that can lead to heart failure, stroke, or worse. The hard truth is that nearly half of all heart attacks fall into this silent category, and the risk climbs dramatically after age 65. Today, we're going to change that. This isn't about creating fear, it's about giving you knowledge. Because knowledge is power, and in this case, it's the power to save a life. Maybe even your own. We will walk through what a silent heart attack truly is, why it's so common in seniors, and how to hear the warnings your body is sending, even when it isn't screaming in pain. Let's start by demystifying the term silent heart attack. The medical name is a silent myocardial infarction. Let's break that down. Myocardial simply refers to your heart muscle. Infarction means the death of tissue due to a lack of oxygen. So, a silent myocardial infarction is the death of heart muscle tissue, just like any other heart attack. The only difference? It happens without the classic movie-style symptoms. There's no crushing chest pain, no dramatic collapse. Think of it like this. A regular heart attack is like a loud, violent storm that rattles the windows of your house. You know it's happening, and you take cover immediately. A silent heart attack is more like termites, quietly eating away at the foundation of your home for days or weeks. The damage is just as real, just as severe, but it happens without any alarm bells. The structural integrity of your heart is compromised, but the warning signs are so subtle they are easily mistaken for something else. You might not even know it occurred until weeks or months later, when a routine EKG reveals that a part of your heart has been permanently damaged. So, the critical question is, why are they so often missed, especially in seniors? There are two primary reasons. First, as we age, our perception of pain can change. The nerve signaling pathways that scream danger in a 40-year-old might only whisper in a 75-year-old. This is a normal physiological change, but it can have dangerous consequences. Second, and perhaps more importantly, the symptoms of a silent heart attack are often masked by other health conditions that are common in later life. Let me tell you about a patient of mine. Let's call him George. George was a vibrant 72-year-old, a passionate gardener who prided himself on his stamina. He came to see me for a routine checkup and mentioned he'd been feeling unusually tired for the past 2 weeks. "Just overdid it with the roses, Doc," he said with a chuckle. His wife added that he seemed a bit breathless after climbing the stairs, and he'd complained of some indigestion that his usual antacids weren't helping. He dismissed the breathlessness as being a bit out of shape, and the indigestion as a result of a spicy meal. Neither George nor his wife was particularly alarmed. They were classic, easy-to-dismiss symptoms. Because he was there, I ran a standard EKG. The results shocked him. The squiggly lines on that paper told a clear story. George had suffered a heart attack. The damage was done. He was incredibly lucky we caught it before a second, more catastrophic event occurred. George's story is a perfect example of what I call symptom overlap. The fatigue, the shortness of breath, the indigestion were all real, but he attributed them to aging, gardening, and diet. He never once thought heart attack. Does any of this sound familiar to you? Have you ever had a new, nagging symptom and immediately found another reason for it? This brings me to the biggest myth I need to bust today. These symptoms are not just old age. That phrase is one of the most dangerous in medicine. While our bodies certainly change, new, persistent, or worsening symptoms are never just a part of getting older. They are signals. They are your body's way of communicating that something has changed and needs attention. Ignoring them is like hearing your smoke alarm beep and deciding to just change the battery later. We have to learn a new language, the subtle language of our bodies, to catch these silent events before they cause irreversible harm. Now that we understand why silent heart attacks happen, let's move on to the most important part of our discussion: the how. How do you recognize one? How do you listen for a whisper when you're expecting a scream? I'm going to walk you through the 7 most critical and most commonly dismissed warning signs. I want you to listen to these not with fear, but with curiosity. Think of yourself as a detective, looking for clues to protect your own health. The first and most common sign is unexplained, profound fatigue. I'm not talking about feeling a little tired at the end of a long day. This is different. This is a bone-deep weariness that isn't relieved by a good night's sleep. It's the feeling of exhaustion after doing something simple, like making your bed or walking to the kitchen. My patient George experienced this for 2 weeks. Why does this happen? When your heart muscle is damaged, it can't pump blood as efficiently. Your body's organs, muscles, and brain are being starved of the oxygen and nutrients they need to function. The result is a systemic, cellular-level exhaustion. Your body is working overtime just to perform basic tasks. If you suddenly feel like your personal energy battery has been drained to zero, and it stays that way for several days without a good reason, like illness or overexertion, that is a major clue. It's your body telling you that the engine isn't getting enough fuel. The second sign is discomfort in your jaw, neck, back, or arms. Notice I said discomfort, not necessarily pain. Many people, especially women, don't experience the classic crushing chest pain. Instead, it might be a dull ache in the jaw, a feeling of tightness in the neck, or a strange, heavy sensation in one or both arms. This is something called referred pain. Your heart itself has very few nerve endings, but it shares a neurological switchboard in your spinal cord with nerves coming from your arms, jaw, and upper back. When the heart sends a distress signal, the brain can get its wires crossed and interprets the signal as coming from these other, more familiar locations. It's incredibly easy to dismiss this. You might think, oh, I must have slept on it wrong, or my arthritis is acting up. But if this discomfort is new, and especially if it seems to get worse with exertion and better with rest, you must consider the possibility that the source isn't your muscle or your joint. It's your heart. Third on our list is digestive issues. This can manifest as sudden nausea, indigestion, or a heartburn-like feeling that isn't related to a meal you just ate. You might feel an unusual fullness or discomfort in the upper abdomen. The reason for this is anatomical. The bottom wall of your heart rests directly on your diaphragm, which separates your chest from your abdomen. When that part of the heart is deprived of oxygen, it can irritate the major nerves in that area, particularly the vagus nerve, which plays a huge role in regulating your digestive system. Your brain interprets this nerve irritation as a stomach problem. So you reach for an antacid, but the feeling persists. Here is a crucial question to ask yourself. Is this indigestion accompanied by any other symptom on our list, like lightheadedness or a clammy sweat? If so, the alarm bells should be ringing loudly. The fourth sign is a subtle but significant change in your breathing. You might find yourself getting short of breath doing an activity that was easy for you last month, like carrying in groceries or climbing a flight of stairs. Medically, we call this dyspnea on exertion. It happens because a struggling heart can't keep up with the body's demands. Blood starts to back up in the vessels that lead from your lungs to your heart, causing pressure to build. This pressure can force fluid into the air sacs in your lungs. You're not just out of shape, you're quite literally experiencing a traffic jam of blood flow that's flooding your lungs. This is one of the most common symptoms to be brushed off as simply getting older. Please, I urge you, do not make that assumption. A sudden decrease in your exercise tolerance is not normal aging, it's a red flag. The fifth and sixth signs often go together: cold sweats and dizziness or lightheadedness. A cold sweat isn't like sweating from heat or exercise. It's a clammy, unnerving feeling that comes on for no reason, even if you're resting in a cool room. This is your body's fight or flight response kicking in. Your nervous system senses the crisis in your heart and floods your system with adrenaline, which triggers sweating. At the same time, the dizziness or feeling that you might faint is a direct result of decreased blood flow to the brain. If the heart's pumping action is compromised, your brain is the first organ to notice the drop in oxygen pressure. It's easy to blame this on dehydration or standing up too quickly, but if it's a new or severe sensation, it warrants immediate attention. Finally, our seventh sign is new or worsening sleep disturbances. Specifically, I'm talking about suddenly needing to prop yourself up with 2 or 3 pillows to be able to breathe comfortably at night. Or, even more alarming, waking up suddenly from a deep sleep, gasping for air. This occurs for the same reason as shortness of breath during the day. When you lie flat, fluid that may have pooled in your legs due to poor circulation gets redistributed, and it can overwhelm your lungs. This is a very serious sign that your heart is struggling to handle its workload. It is not normal insomnia. It is a sign of heart failure, which is often the direct result of damage from a prior silent heart attack. The key takeaway from all of these signs is to pay attention to changes from your baseline. If a symptom is new, if it's persistent, and if it doesn't have a clear explanation, it is no longer something you can afford to ignore. Recognizing the warning signs is your first line of defense, but your second, and perhaps more powerful line of defense is understanding your own personal risk profile. Think of it this way. If you know you live in an area prone to earthquakes, you take steps to reinforce your home's foundation. The same logic applies to your heart. We need to look at the factors that might make your personal foundation more vulnerable to one of these silent, seismic events. These risks fall into 2 categories: the medical conditions you manage and the lifestyle choices you make every single day. Let's start with the big medical risk factors. I call these the Big Five, and they are crucial to control. First is high blood pressure, or hypertension. Imagine your arteries are like a delicate garden hose. Normal blood pressure is like water flowing through gently. High blood pressure is like having the spigot cranked open to full blast, 24 hours a day. Over time, that relentless pressure damages the smooth inner lining of the hose, creating tiny cracks and rough patches. Second is high cholesterol, specifically the LDL or lousy cholesterol. This is the waxy, sticky substance that latches onto those rough patches in your arteries, forming plaques. A heart attack, silent or otherwise, is most often caused by one of these plaques suddenly rupturing. Third, and critically important for silent heart attacks, is diabetes. Uncontrolled high blood sugar is incredibly damaging. It acts like sandpaper on your blood vessels, accelerating the plaque buildup. But it also damages your nerves, a condition called diabetic neuropathy. This is a key reason why a heart attack that should be incredibly painful can be dulled or completely silent in someone with diabetes. The body's alarm system has been effectively disabled. The last 2 are chronic kidney disease and a previous history of heart disease. Your heart and kidneys are partners. When one is struggling, it puts immense strain on the other. And, of course, if you've had a previous cardiac event, your risk for another is significantly higher. Now, let's talk about the lifestyle risks, and I want you to listen to this part with a sense of hope because these are the areas where you have the most direct control. These include a sedentary lifestyle, a history of smoking, and a diet high in processed foods, unhealthy fats, and sodium. But I want to add 2 more that we now know, from overwhelming evidence, are just as dangerous: chronic stress and social isolation. We have definitive proof that loneliness and unmanaged stress have a direct, physical, and toxic effect on your heart. They increase inflammation throughout your body and elevate stress hormones like cortisol, which over time contributes to high blood pressure and plaque formation. Reaching out to a friend, joining a community group, or talking with a family member is an ishurti just good for your mood. It is a medically necessary action for your cardiovascular health. Hearing this entire list can feel daunting, I know. But please, don't see it as a list of threats. See it as your personal roadmap to prevention. Every single risk factor is a signpost pointing you toward an action you can take. This brings us to the most empowering part of our conversation: your plan for prevention and early detection. First, you must know your numbers. You should know 4 key numbers as well as you know your own phone number: your blood pressure, your cholesterol levels, your fasting blood sugar, or HbA1c, and your weight. These are not just numbers on a chart, they are the vital signs of your heart as health. Get them checked regularly, write them down, and ask your doctor what your personal goals should be. Depending on your risk profile, a regular screening EKG or even a stress test might be recommended to get a baseline picture of your heart's electrical activity and function. Second, embrace simple technology. A home blood pressure monitor is an inexpensive and incredibly valuable tool. Checking your pressure at home, when you're relaxed, gives a much more accurate picture than a single reading in a busy doctor's office. Smartwatches and fitness trackers can also be helpful for monitoring your heart rate trends and encouraging daily activity. But a word of caution: while these are great for motivation, they are not medical devices. Use them to gather information to discuss with your doctor, not to diagnose yourself. Finally, and most importantly, is to treat your lifestyle as medicine. You don't need a dramatic overhaul. Start with small, sustainable changes. Swap 1 sugary soda for a glass of water. Add a handful of spinach to your eggs. Go for a 15-minute walk after dinner. The best exercise for your heart is the one you will consistently do. And please be diligent with your medications. I know it can be a hassle to manage multiple prescriptions, but those pills for blood pressure, cholesterol, or diabetes are your silent guardians. They are working around the clock to reinforce your foundation. Use a pill organizer, set a daily alarm, and never, ever stop a medication without first talking to your doctor. Your daily choices, combined with a clear understanding of your medical numbers, are the most powerful tools you have to prevent a silent heart attack from ever taking you by surprise. We've covered how to recognize the subtle signs of a silent heart attack and how to understand your personal risk factors. Now, we must talk about what to do in the moment. Knowledge is crucial, but a plan is what saves lives. When you suspect something is wrong, your mind can race, and it's easy to feel overwhelmed. That's why you need a clear, simple emergency action plan that you can follow without having to think. We're going to create that plan together, right now. First, and most importantly, when do you call 911? The answer is simpler than you think. You call whenever you are in doubt. Please hear me on this. Do not worry about being a bother or a false alarm. Emergency responders would rather arrive to find you are perfectly fine 100 times than be called one time when it's too late. You should call 911 immediately if you experience a combination of any of the 7 signs we discussed. For example, sudden fatigue accompanied by indigestion and mild arm discomfort. You should also call for any symptom that is sudden and severe, or one that simply feels deeply wrong or frightening to you. And when you make that call, you must not, under any circumstances, attempt to drive yourself to the hospital. Call an ambulance. The care you need doesn't start at the hospital door. It starts the moment paramedics walk through your door. They can administer oxygen, give life-saving medications, and monitor your heart with an EKG on the way, saving precious, irreplaceable heart muscle. So, you've called 911. What should you do in the few minutes while you wait for help to arrive? 3 simple things. First, if you can, unlock your front door so the emergency team can get in without delay. Second, sit down in a comfortable chair, preferably one with armrests. Try to remain calm and take slow, steady breaths. Lying down flat can sometimes make breathing more difficult if your heart is struggling, so sitting is often best. Third, loosen any tight clothing around your neck or waist, like a collar or a belt. Next, let's discuss the aspirin protocol. Now this comes with a very important disclaimer. You must discuss this with your own doctor to see if it is safe for you, especially if you have a history of bleeding ulcers or are already taking a prescription blood thinner. However, if your doctor has given you the okay, the standard emergency protocol is to chew one full-strength 325 milligram aspirin. Chewing it, rather than swallowing it whole, helps it get absorbed into your bloodstream much faster. Why aspirin? During a heart attack, a blood clot is forming inside a coronary artery. Aspirin is an antiplatelet medication. It works by making your blood platelets less sticky, which can help stop that dangerous clot from getting bigger while you wait for more advanced medical treatment. Finally, a crucial part of your plan is being prepared with information. Paramedics and emergency room doctors have to work fast. You can help them by having a go packet ready. This can be a simple piece of paper on your refrigerator or a note in your phone that lists your current medications and their dosages, your major health conditions and past surgeries, the name and number of your primary doctor, and an emergency contact. This information is priceless. It allows the medical team to make the best decisions for you without any dangerous guesswork. And please, talk about this plan with your loved ones. Make sure your spouse, your children, or a trusted neighbor knows where to find this information. It's a simple conversation that can make all the difference. We've covered a lot of ground today, and I want to leave you with one final, essential thought. The single most important takeaway from our time together is this. You must stop attributing new, persistent, or unusual symptoms to just getting older. That is a dangerous habit. Your body is constantly communicating with you. It is your great responsibility and privilege to learn how to listen to it, to hear its whispers so you never have to hear it scream. To help you put all of this into action, I'm giving you 3 doctor's orders. First, before this week ends, schedule your annual checkup or a specific visit to discuss your heart health with your doctor. Second, for the next 2 weeks, keep a simple symptom diary. Note down any unusual feelings, the time they occurred, and what you were doing. This data will be invaluable. And third, please share this video. Send it to at least one friend or family member over the age of 60. You never know whose life you might touch. If you found this information helpful, I hope you'll subscribe to the channel. My promise to you is to continue providing clear, evidence-based medical advice to empower you to live a healthier and more vibrant life. Be sure to join me for our next video, where I'll be showing you a simple 5-minute morning routine that can help protect your heart all day long. Until then, be well, stay informed, and listen to your body. It's the best guide you will ever have.